It's always intriguing to talk about healthcare and technology, and today I'm talking with Tobias Gantner. He is the founder of HealthCare Futurists, based in Germany, but he's acting globally, and he's going to tell us a bit about what he's doing with his organization in the area of innovation in healthcare. So, welcome, Tobias.
Thank you.
Uh, just start and tell us what you're doing with your organization.
Thank you, Peter, for having me. I'm really happy. So my name is Tobias Gantner. I'm a medical doctor by training, but I stopped working with patients for about 10 years, 10 years ago. I got a law degree and a business degree and did a couple of other things, worked in big industry. And then about 7 years ago, I decided that I need to run my own business, which is the HealthCare Futurists. We are a think tank and a make tank. And we do kind of crazy stuff, which you will be probably seeing in a couple of years in the shelves of your favorite gear and technology shop. For that, in order to illustrate this a little bit, I have provided a little presentation to walk you through what we are doing and what is already happening. So as you can see, we are a think tank and a make tank, and we take pride in having opened up the first healthcare Tomorrowland. It's basically a connection of all things that make sense in healthcare, including 3D printing of medication, artificial intelligence, and so forth. Interesting is that we're always trying to think about the patient and what comes to the patient. And we do a lot of cross-vertical stuff. For instance, we work with the car manufacturers and we put sensors in their cars. And it will probably take some time until we find medical grade devices in cars. And yet we try to make people dream. And this is what we did, for instance, for toddlers. So we took this little toddler chair and we added technology in there. So you can measure blood pressure, heart rate, blood glucose level. We have even installed a camera in the handle equipped with artificial intelligence to see how the child is actually doing. This is by no means a medical device after all. This is a lifestyle kind of thing. But we want people to get the idea what is possible with the technology and sensors that we have already at hand. We also kicked off a pro bono project when we were in our first lockdown with COVID-19. It's faster than Corona. Faster than Corona is the idea through digital transformation. We can spread the word and help much faster than the virus can spread, actually. And this is why we started with our data against Corona. The idea is we go for altruistic data donation, which means you donate your data anonymously. We collect your data, we scramble your data with our artificial intelligence. We find out correlations, causalities. Do people with a certain blood type run a higher risk of running into a casualty, a fatality with COVID-19, for instance? Do medications protect you from acquiring a COVID-19 and so forth? We share our data. This is an open data project with anybody who has a valid research question. We work together with the WHO and other institutes. If you want to get more interesting information on that, just go to our website, fasterthancorona.org. And this is what we want. We want Corona to leave, because as much as I love technology, I'd rather meet people in person than go through screening messages all the time. We also started a project a couple of years ago, which is called the No Doctor's Office. This is a doctor's office where there's no physical doctor. We have very specially trained nurses that see patients in rural areas where there's no medical coverage, no doctors whatsoever, and that work with these doctors. So this is what we do. We employ nurses that get a special training. We have a patient on the right-hand side, and they use high quality technology gear that transmits slides, pictures, results, data to doctors that are actually working from remote within this clinical setting. Where does this all come from? Well, we do a lot of hackathons and innovation labs. And throughout the years, we thought we need to get our own fab lab. This is why we conceived the Healthcare Maker Mobile. It's future to try out. It's the fast and the futurist and the health hack. So this car has a lot of technology in it, and we have flight cases full of 3D printing gears, virtual reality, augmented reality gear, robots, you name it. So this makes it possible for us to go to a lot of places. This is when we were 2 weeks ago at the Allianz Arena in Munich. where a big publishing house had an actual face-to-face meeting. This is our car in action. We have a lot of lightning stuff there, but a lot of technology as well. And we'll be happy to see you at your venue. And what we do with this, well, for instance, we built this kicker table here. And you know this from bars and pubs. And what we do, we take this into the new level of digital transformation. We put sensors in that thing. So what we do is we measure tremor in Parkinson patients. We measure memory capacities and capabilities in patients with Alzheimer's. We work with patients who have multiple sclerosis, and we try to help them to actually get out their best and perform neurology tests, and not the ones that we know from clinical settings, but tests that are connected with gamification and with new technology. We collect the data here, we run this through an artificial intelligence. We can even predict which team is more likely to win. So you are cordially invited to battle and compete with us in a kicker team, in a kicker play next time we meet. If you got more interested in what we're doing, we have a channel, which is right now in German only, but we're doing our best to actually bring this also to the English speakers. It's called Dr. Future, and we test drive the future. We take apps, gadgets, wearables, gizmos, and we tear them apart. We take screwdrivers, we test whether they can actually live up to their legacy, and this is what we put on YouTube. So thank you very much, Peter, for giving me the opportunity to swiftly present the HealthCare Futurists. We are all about democratizing of healthcare. It's all about the patient. Nothing goes with the patient. And if you are in the same choir as we are, happy to get in touch with you.
Thank you very much, Tobias. As usual, you do a sort of pitch in a very short time. So great that this overview. What is it exactly? What drives you to do this? I mean, is it the healthcare topic? Is it also the fun topic? What is?
Yeah, I'm curious. You know, I'm curious by nature or by default. Yeah. So I think we need to bring different subjects together. You know, healthcare is not a standalone kind of thing, because if you look at a human being, it's not just about a somatic condition that might bring someone to a doctor. It's also, what do people actually value? What values do they have? What do they believe? How is their economic situation, and so forth. So this is where healthcare meets law, meets economy, meets technology, all that. And I think we're living in great times. We're living in challenging times as well, but we're living in great times where we have all these technologies now ready to be used. This is not an ivory tower kind of thing, but we can use this. So we can build technology in cars, in everyday gadgets and objects, and we can show people that digital transformation is not just ordering books at Amazon or pizza at Delivery Hero. It's more to it. And this is actually where we want to go. And we always want to be pioneers. We want to be the first on the mountaintop or the first on the South Pole, and put our flag there and say, we've been there, we've done that, it's possible, and now way to go.
Okay, well, that's great. That's a good explanation. And as always, at the end of a presentation talk, I ask a personal question to every speaker, and that is, what is your favorite thing or your passion apart from technology? Yeah, that's clear. But music or food or whatever. So share it with us.
well, throughout COVID-19, I got to know my family much better because I was confined at home, and I found our old piano sitting in a room, and I thought, hey, why not try piano? So I'm now studying piano, and I'm an avid guitar player. So I work with my guitars, and I now convert what I learned with my guitar to my piano, and I actually already started playing some boogie woogie there. So, okay. I mean, music is my passion, and I think music is a universal language. Everybody on this planet speaks music, and this is great. And this is also a great pastime beyond all the technology. But then again, you know, I'm also using technology to improve my piano skills with a lot of apps that are out there that can actually tell you what you need to do in order to get to the next level.
Okay, well, thank you very much, Tobias. Thank you.